Hi and welcome back. Today I have a fascinating video for you. In today's video, we are talking to Dr. Joy Kong about the incredible restorative, regenerative, and anti-aging benefits of stem cell therapy. Dr. Kong is a triple board certified physician, certified in psychiatry and neurology, addiction medicine, and anti-aging and regenerative medicine. Dr. Kong is the president of Uplyft Longevity Center in Los Angeles, and she was recognized as the stem cell doctor of the decade in 2021. I first saw Dr. Kong on my friend Cheryl's YouTube channel, Yoga Girls World. Cheryl interviewed Dr. Kong, and I was so intrigued by the interview that I right away picked up the phone and called Dr. Kong for a consultation and also asked her would she appear on my channel. And she said yes, which made me really happy. So without further ado, let's talk to Dr. Kong. Thank you so much for being here, Dr. Kong.
You're so welcome, Claudia. It's my pleasure.
I'm so excited to talk to you. I have watched so many of your videos and I have so many questions. But let's start at the beginning. What are stem cells?
So I always talk about the beginning, which is when we were in our mother's womb, starting as a fertilized egg. So that was the quintessential stem cell. That is an all-powerful stem cell. From that one stem cell, it will start to divide and start to make new kinds of stem cells. So up to the point where it's making specific tissues, specific organs, all those are stem cells. There are just many, many layers and processes and steps of stem cells. So when you start to make an organ, that's when you have organ cells. So those are terminal cells, are not stem cells anymore. That's all they do. They've gained a lot of function, but they've lost a lot of potential. But in each organ, there are also organ-specific stem cells, like in your liver, in your heart, there are liver cells, stem cells, and heart stem cells. From those stem cells, they can only become a liver cell or a heart cell. But in between the organ-specific stem cell and the first fertilized egg, there are thousands, probably tens of thousands of variations of these cells with all kinds of different potential, but are in the process of making the next step, the next generation of cells. So it's a very complex process. And all along the way, anywhere in between, we can get a type of cell out and try to utilize it. So what we're utilizing it, for the most part, the most popular one right now is mesenchymal stem cell. So that's kind of in between, between the first fertilized egg and then the final tissue-specific stem cell. So this is kind of in between. An earlier one will be the embryonic stem cell. So those are very specific. When you try to obtain an embryonic stem cell, you usually get it from day 5 to 7 of fertilization. So once the egg is fertilized, day 5 to 7, that's when a ball is formed. And within the ball, there are all these cells inside the ball. So those are the cells you can take out and can make a full human being. So that's earlier on, but those have higher potentials to cause cancer, cause tumor. The further the cells divide and get down on its path of becoming more specialized stem cell, it starts to lose a lot of the potential where it can go haywire. So so it's a complex question, what is stem cell? But the quintessential feature is that it can replicate itself. So it can make an identical copy of itself or make a copy of itself and a daughter cell. The daughter cell will be more differentiated, gaining more features and functions and surface markers. And then it can replenish the tissue where it resides. So that's kind of the definition of a stem cell.
Now, before we talk about what stem cells you prefer, let's briefly talk about the legality and the ethicality of stem cells, because I think there's still a lot of sort of misinformation and also a lot of unknown about stem cells. And even if I talk about topical stem cell serums or growth factor serums, I often get the question, are these ethically harvested?
Ethical issues is a big concern. There's so many misconceptions, so many myths. So the ethical issues, of course, started with, we're dealing with life, right? So when they first started getting stem cells, it was from a fertilized egg. So there are different philosophical approaches of when life began. So some people think is equivalent to killing a full-grown human. So that's where the first controversy started. So when you are getting cells from the embryonic stem cell, which came from this fertilized egg, this embryo, then you are destroying an embryo. So that's where the first problem came about. And then George Bush was the one that banned making any new cell lines from a fertilized egg. But the existing lines are allowed to be continued, but for research purposes. So like I mentioned, these embryonic stem cells, we have trouble controlling them. They can cause this uncontrolled growth called teratoma. So there's a risk involved. And then if you are looking at a person's own stem cell, there's this huge controversy. The FDA wanted to govern it or regulate it as a drug, but the doctors are fighting back. Doctors said, no, why is this different from organ transplantation or blood transfusion, where doctors were dealing with the human body? We can't transplant from one person to another, or we can transplant within the person, right? We're grafting within the person. So this should be within the realm of the practice of medicine. So that's where the conflict between the doctor who are trying to bring about some healing for people and the regulatory entities. So really, when you're not destroying an embryo, the ethical concerns are much less. Of course, there's also the aborted fetuses aspect. I have not seen anyone doing it in the United States. That would be extremely clandestine and strange. If anyone is doing it, I haven't heard of anyone doing it. Is it possible? Yes, it's possible. In countries like Ukraine is the most famous for using fetal cells. It is questionable the way they were obtaining it, because they were getting it from Russian women who were, getting abortions. They were selling the fetuses that they are aborting. So there's, that's a ethical concern, but that's not what's happening in the United States. So when we use umbilical cord stem cells, it's unfortunate. Umbilical sounds a little similar to embryonic. So I can't tell you how many people get these two confused. Umbilical cord stem cells came from the umbilical cord. That means the baby has been formed, and it's supposed to be obtained at the time of birth. We cut the cord, right? Baby's freed up, and then the cord and placenta is put in a saline bag, put on ice, and shipped to a lab to be processed. So nobody's harmed. These tissue would usually be tossed in the biological waste basket. So now we can utilize them because they're really rich in stem cells. And now I can talk about, the features of the stem cells within the tissue, which I do believe is superior to the existing stem cells that we're currently utilizing within the adult body. So so the ethical issue is really not a concern when it comes to umbilical cord stem cells.
So I'm gathering you're using umbilical cord stem cells.
Right. So that was my, passion. 7 years ago, when I came into the field, I was faced with a choice. Do I want to use the person's own fat or bone marrow or umbilical cord? These are the three big camps. In my intellectual curiosity, I started to just start reading articles after articles. And I wanted to answer that question. What's the difference between these sources? And what should I give patients? I just want to give them whatever that's going to heal them, whatever that works the best. So let me find out, has anyone studied the differences between these sources? That's where that lecture came about. That was the first lecture I presented at different conferences. Apparently no one was asking the question, or no one took the time to find out what evidence are, existent. So looking at research articles, comparing growth factor profiles, differentiation potentials, how many generations are left, the telomere length, mitochondrial health, just everything, the rate of senescence. When you compare all these different parameters, really, if you look at my lecture, there's no question that umbilical cord cells are superior. They're much more potent. They even have less cancer risk. So if you use your own stem cells, there tend to be more potential to exacerbate existing cancer. They're not going to form new cancer, but they could tell everything to grow indiscriminately. Whereas umbilical cord stem cells seem to have that ability to discern if a cell or cluster of cells are cancerous and are able to send corresponding signals to get rid of them. So there's vast difference between these tissue sources. The younger sources seem to be just more vibrant and a little smarter. So then to me, it's my obligation to give people what works the best and the safest. So that lecture I put online because I just want the information to be out there. It's called ROMSEs Created Equal. So it's on YouTube. That's the one I presented at various conferences, and doctors were very interested, and they were like, wow, I had no idea. That's how I came about, with the umbilical cord cell as my treatment choice.
And that makes a lot of sense. As you said, if I'm using my own stem cells, whether they are from my bone marrow, whether they are from my blood, they're going to be 54 years old. They're going to have all kinds of inflammation possibly or disease. So it makes a lot of sense that you're using the freshest and the youngest you can get.
They've been around with you, their toxins build up, their probably misfolded protein build up, their DNA, damages, and they're all with you. So these cells are not dormant. These stem cells, if we're looking at mesenchymal stem cells, so when you get it from bone marrow, there are a lot of mononuclear cells, which are these primitive immune cells, and you have some hematopoietic progenitor cells that would form all the bloodlines. And then you have, a few other things, and then some mesenchymal stem cells. So none of these cells are dormant. They're all metabolically, they're alive. So when they're alive, then they have the capability to absorb all the environmental insults, right? All the toxins, the oxidative damages, the free radicals, they can all get to it. So they carry with you. And there's no question that's there are changes. They go along with you. And I've had some friendly discussions with people who are in the camp of fat-derived stem cells. So I remember this lady, she's a very vocal voice in this stem cell arena, and she said, "Well, these cells are dormant. They're they are not active. They've been hibernating in the fat," and to me, it's very silly to think that. First of all, it's not true. Second of all, I think it would be very strange if your own egg and sperm can decline with age, yet you keep these fat-derived stem cells perfectly good and dormant throughout your life, and probably not usable until fat-derived stem cell therapy is discovered, right? I mean, that's kind of, it doesn't make any sense, intuitive sense. So that's my answer to that.
Yeah, makes sense. Now, you keep bringing up the word mesenchymal cells. If I remember my biology correctly, those are cells that can basically become any other cell, correct?
They can become technically any cell line within the mesoderm layer. So those will include, a lot of the muscular skeletal system and some other tissues. But what's interesting is the younger the cells are, the more they could differentiate, because we've found out that these mesenchymal stem cells have been able to differentiate and develop into a liver cell or even a neuron or other brain cells. So the younger they are, the more flexible they are. So it's not so strict that I'm in this layer, these are all the cells I can develop. It's a lot more fluid. Which is exciting.
Now, what sort of conditions, diseases do you treat with stem cell therapy?
I have to make a disclaimer. I do not treat any diseases with stem cell therapy. The only FDA approved treatment for any disease will be hemoreconstitution. That means if you have your immune system destroyed, either because of cancer or because of your treatment for cancer, for certain disease or autoimmune disease, they wipe out your immune system. And then they introduce, most of the time, early on, bone marrow transplant. And that's the earliest stem cell treatment. They give you bone marrow from somebody else, which contains all these stem cells. So that's the only FDA approval for diseases. Everything else will be off-label use. Of course, at least 80% of medicine is practiced off-label. So the conditions that there has been clinical studies on is vast. I've given presentation about stem cell therapy in diverse disease conditions. I mean, I founded an academy, American Academy of Integrative Cell Therapy, where I'm teaching doctors exactly what the evidence are in different conditions. So I speak of research evidence and definitely not, I'm saying that I'm treating it. I'm just showing what is available, what has been shown, and the cells are there to augment and help your body, assist your body in its repair capacity. So that's as far as I would go. But clinically, have I seen benefits when I was treating patients that had certain conditions? Yes, I've seen some drastic results, and some are hopeless cases when you are looking at what modern medicine has to offer, like COPD, like liver cirrhosis, like cardiac, cardiomyopathy, declining heart function. These are extremely difficult things for modern medicine to treat. Once the heart has fibrosed, once it's been damaged, it's pretty difficult to reverse. They generally are keeping people, their victory will be to sustain the current level. If they can keep you where you're at, then they think that they are winning. But that's not what excites me. I want to reverse. I want to get people to heal, because there's this innate healing capacity we have. We've all heard of spontaneous remission, right? You can't deny it has happened because it's documented. Why? Nobody can explain. Well, guess what? The body has the capacity. So if we can tap into that capacity, we can use something else to awaken that capacity. And that's where we can transform where medicine is at.
I've heard you say that stem cells have a very high potential to decrease inflammation. And obviously, as we age, inflammation rises. We call it inflammaging. Do you think there's a correlation between, as we age, we have less and less stem cells and this rise in inflammation?
Yeah, definitely. I think that's a big factor. Stem cells, there's a nutrition rate. They don't just keep living on your body. They work, they die, and they senesce. So you just get less and less. The statistic I talk about is when you just look at mesenchymal stem cells, which are all over your body. So anywhere you have blood vessels, you will have these mesenchymal stem cells. So before they become mesenchymal stem cell, when they're cuddling around the blood vessels, they're called pericytes. So peri, all around the blood vessel. And so these mesenchymal stem cells throughout your body will provide this ability to regenerate for your body. It's going to sense what's going on in your blood, and it's going to sense what's going on in your neighboring tissue, and it's going to coordinate this repair. So when you were born, every 1 in 10,000 cells is mesenchymal stem cell. But by the time you reach your teenage years, it's only 1 in 100,000. So from 1 in 10,000 to 1 in 100,000, even though you're still a young kid, it's only 1/10 of what it was. And then when you reach your 40s, is 1 in 400,000. When you reach your 80s, is 1 in 2 million. So you're just running out of this signaling, I call it like a smart pharmacy in your body, used to be all over your body, ready to work, ready to send signals. And then it just get less and less and less. They're just not enough to keep up with the demand. So the inflammation level rises as we age. It's an independent thing, independent of your health state. So, it doesn't matter if you are the most vibrant 65-year-old. If I measure your inflammation markers, it's going to be elevated. There's sickness doesn't have to be involved. Just by aging is elevated. And when you can reduce the inflammation, then you can definitely reduce the rate of aging, and you can reduce all the damages, which aging is the biggest predictor of diseases. If you can reverse the biological age by 7 years, let's say we can reverse everybody's biological age by 7 years, we are cutting down the existing chronic illness by 50%. So that's how powerful aging is in pushing the disease process. And aging, we all know, is, for a huge part, is driven by inflammation.
You brought up that stem cells also become senescent. I talk about senescence quite a bit on my channel, but strangely, it has never occurred to me that stem cells also become senescent. And that's a big problem because senescent cells secrete inflammatory cytokines, which then destroy other cells.
Yeah, exactly. I coined the term cellular dementia. I think they're getting a little demented also. They don't keep their marbles. They can't do what they used to do, and then they make mistakes, and then they start to, like in the cancer case, this really elegant study was showing how fat-derived stem cells when you put it next to glioblastoma, a very virulent form of brain cancer, the cancer just keep growing. It just is telling the cancer to grow. But if you use umbilical cord derived stem cells, the cancer is going to start to shrink away. So that's how different they are, even though they're all technically mesenchymal stem cells. But the age are different, and they've gone through different things in life. And the older ones have lost some capabilities.
Will using these umbilical cord stem cells also affect senescence in our existing stem cells?
So that gets into the question of how many cells are going to stay in the body. What they've shown, I don't know if it does anything to the existing population, but some stem cells do stay. There's still a question of how many actually will stay in the body. I've talked to all kinds of, some prominent scientists, from around the world, and nobody knows the answer. And I was like, what do you think? Tell me how many actually stay in the body when I give people infusion? So nobody knows, but the general consensus is probably about 2 to 5%. So you're going to have some that will stay in your body. Just like we've seen in animal studies, we can give an animal human stem cells, and lo and behold, the human stem cells have become part of the animal. And, it doesn't matter. It has human genes. It's become just part of the animal, like, for example, the skin. And yeah, it's a patch of skin that has human genes, but didn't matter. It adapted to the animal. So you can definitely have new cells that stay. But what's interesting is that these stem cells, they also have fresh mitochondria, right? When you're using young sources, if you're using your own, that's your own mitochondria, whatever the state it is in. But when you use young, fresh cells, they have the capability of transferring mitochondria to the recipient and elevating the cellular energy of the recipient cells. So that's pretty cool. The other thing is, the stem cells do produce exosomes. These are little packets, tiny nanometer size packages that contain a lot of growth factors and cytokines and microRNAs. So these microRNA are able to go inside the cell nucleus and repair the DNA. So in that sense, you are rejuvenating your cells because they're able to do some repair. That's why there's longer term benefit. I mean, it's not going to last forever, but there's definitely significant longer term benefit, even when the cells are not around. Most of the cells, may be dead, because when you infuse cells, no cells are going to live forever. They go in there, calm your inflammation, fight your battles, and they die. Like all live things alive, they will have a lifespan. So even if they're dead, you could still be benefiting it, a year or two down the line because of this renovation of your DNA. And we've seen with repeated IV infusions of these young stem cells, research has been done looking at what happens this is animal study, what happens in the animal's brain and their muscles. All the neurotransmitter levels have gone back to the younger state. The senescent markers are back to the younger state, their growth factor profile. So everything was back to the younger state, which is pretty exciting.
So I was just going to ask you, so you said with repeated IV injections, I wanted to ask you, how do you treat with stem cells? I told you earlier, I had localized stem cell injections in my neck after I broke it, but it sounds like you don't do localized, you do IV injections.
Oh, I do. I do a lot of localized.
Okay.
Yeah. So it really depends on what we're trying to help. So first of all the IV treatments, that's considered experimental. It's clearly laid out in the consent form. It's unfortunately, I guess it's all field of medicine or even supplement industry. We have to be very careful not to make claims, right? So I'm not treating any condition. And the IV approach has been used in thousands of research experiments. So I'm following what research has shown and what the benefit, what potential benefits might be. And that's what I explain to patients. So when I'm looking at something that's more systemic, like autoimmune diseases, right? It's throughout your body, some inflammation-based conditions, definitely an IV approach is what makes sense and has been shown to be pretty helpful. And for organs that are well perfused, so like the heart, the liver, the lungs, the spleen, kidneys, all these are, even small joints, they're very well perfused. So whatever I put in the blood, it's going to get to that tissue. Of course, will there be more if I inject directly in that area? Yes. But the good thing is those disease areas will attract cells, kind of grab the cells out of circulation because they are inflamed. So a lot of these conditions can be approached from the IV route. So I've definitely treated patients that have, COPD, liver disease, heart problems, kidney issues, testicular problems, or somebody wants to rejuvenate ovarian function, even things of the brain. We can give people certain molecules to help open up the blood-brain barrier so more cells can get into the brain. So there are a lot of things that can be approached by the IV route. The exceptions will be, the biggest exception will be larger joints, because something like the knee, the hip, shoulders, if you're trying to target the knee, the joint itself, then you need to put your cells in there, because the exchange between the blood and the joint is so slow. It may take 2 months for anything I put in the blood to actually reach the joint. And that's when you want to just put in the joint space. Of course, other things will be definitely, I don't do that, but there are doctors who put stem cells directly into the spinal cord, the spinal canal, to bathe the spinal cord and also get into the brain. So you get more localized delivery, because it is harder to get cells into the brain. So yeah, there are a few cases that definitely I think local will be helpful. But, even for local diseases, I don't believe that local injections will always be better than an IV injection. I think IV will give you this broad range of benefit that's going to talk to your immune system and your spleen, your lymphoid organs, the entire, peripheral lymphoid system. And that's going to mount this repair, this, campaign that you wouldn't have if you just put the cells in a local location. Of course, anything you put locally, everything is systemic. So everything we do in medicine, when, people splitting hair, there's a local, a systemic, everything gets into systemic. So
now, is stem cell therapy something you would use just for general anti-aging as well, even if you don't have any disease or injuries or something like that?
Yeah, I do it for myself. When I first heard about stem cell treatment, I was like, well, this is so amazing. This one lady, she had rheumatoid arthritis. She was on medications and just, kind of miserable. And she did one stem cell infusion within a few hours. The swelling, her finger went down. She was able to wear rings that she hadn't been able to wear for years. She was feeling amazing. She had high sex drive, and she was telling me all these fun things. I was like, wow, this is amazing. I would love to put this in my body. And I'm sure I'm not perfect. I'm sure we're all aging. So why don't I see what these cells can do for me? So that's even before I started reading research articles on the anti-aging benefits, which were pretty remarkable. Regular IV infusions for animals definitely extend the lifespan by about 30%. So that's when I started just doing it for myself. There are other people who are doing it too, but I think I was very consistent because it's been 7 years and I've been doing that every 3 months. What's fun is that I just wanted to feel good, right? I wanted to feel vibrant and healthy, but I think it actually made me look younger, which is really, a lovely benefit.
Do you also feel more vibrant? Can you feel the difference from the injections?
What's interesting, I have to be honest, most of the time I don't feel a whole lot. So that's something I want people to realize. When you're already healthy, there's not a whole lot of parameters. Sometimes when I get an infusion, I may feel heightened energy for a few days. I've noticed like increased sex drive maybe for a few days, but majority of the time I'm not noticing anything, but I'm doing this on faith. Like I tell people, when you are getting sick, the majority of time before you started noticing symptoms, were you sick? It's not like one morning you wake up, boom, you're sick, right? It's been building up probably for days and weeks. So, but it's imperceptible. So you didn't know. Same with healing. Things are repairing. Doesn't mean that it's all above the radar. It could be under the radar that you don't notice. So especially if you don't have a lot of symptoms, it's really not much to compare with. So I just kept doing it on faith because I've read so many articles knowing what the cells can do. So, in my mind, I know it's doing this and this, all these biochemical, interactions. I was like, I know it's doing something, even though I can't feel it.
You do your own treatments every 3 months.
So our anti-aging regimen is a stem cell treatment every 3 to 6 months. The rationale is that the cells will live in your body for about 1 to 3 months. And then their effect will last another 3 months or so because the cells secrete exosomes, and the exosomes usually have an effect for about 3 months. So that's why, it's 3 to 6 months. If you always want some young cells in your body, then do it every 3 months. If you always want the effect of stem cells, then every 6 months.
Now, since you just talked about the superficial benefits of stem cells, let's talk about applying stem cells topically. I know you actually have a stem cell. I don't know if it's a serum, it's a cream. I haven't tried it. I'm very curious to try the cream. But tell us a little bit about that. What's in it? What makes it special?
Yeah, so it really came from very selfish reasons that I wanted a good cream. And, knowing about the toxic effects of all these synthetic ingredients, I just did not want them to be on my face because I know the skin is extremely absorbent. Everything you put on the face is going to get into your blood. And I didn't know why it was so hard to find something that's all natural. When I bought expensive products and they said it's all natural, when I actually look at the ingredients, there's still things that were synthetic, and I just didn't want to deal with it. So I realized, okay, so then maybe if I make it myself, then for sure I know what I'm putting in there. But I also happen to have access to stem cells and to peptides. So why don't I put those in there, really supercharge the cream, and then I put in as many amazing things as I want. So I put a lot of stuff, a lot of wonderful herbs. So we have, a group of peptides. And then the stem cells is umbilical cord derived stem cells. The cells are not alive. I don't want people to, have this misconception that we're putting live cells on our face. But whatever that's in the cells, all the beneficial regenerative components are still there. So they will be right on your face and they will be absorbed. So the stem cells and the peptides and lots of natural oils, natural herbal extracts, some antioxidants and prebiotics, because we don't want to forget the little critters that help us to be healthy. So that's the concoction that I came up with. And that's the only thing I'll put on my face for the last 3 years. And many estheticians, these are people who have seen everything and absolutely are in love with the products. And we have doctors who were carrying really expensive lines, and after using our products and basically said, we'll just get these lines finished, and that your product Chara Omni is the only thing I'll carry. So it's really fun. Yeah, we made a lot of people very happy, men and women.
Well, your skin looks incredible.
Oh,
now,
thank you.
there are some skeptics. I get the question quite a bit. What does it do to put growth factors or stem cells on our skin? I think people can sort of rationalize a bit more if you inject them in your bloodstream, but to put them on your skin, actually, I think there's a bit of skepticism. So can you tell us, what do these stem cells, along with the peptides, actually do for our skin?
All the growth factors, the exosomes, the just regenerative molecules, they're very easily absorbable. So they're going to be absorbed right there by your skin. And the peptides are amazing, of course. A lot of studies on these peptides, reducing fine lines, reducing inflammation, getting rid of discolorations, and promoting collagen production. So those are pretty well studied, controlled study before and after, all the photos and, different imaging and even biopsy, that they were able to look at the difference it's making. So yeah, putting them all together, why not reap the benefit of modern medicine? It's really exciting. And people don't realize how fast we're going. New things keep coming up, new type of molecules, new approaches. So it's important to keep up. I'm sure this is not the final product. As I learn, as I gather more incredible things, I will incorporate them into the cream.
Your cream sounds amazing. It's on my list to order. I can't wait to try it. But you just mentioned peptides, and that is something else you offer in your clinic, is peptide treatments. And it's something I'm very curious about. I actually just recently had a consultation with one of your colleagues on peptide therapy, and it's something I'm going to try. But tell us a bit more about peptide therapy. Why is it so exciting? What can you do for us? What sort of peptides are out there? I have 1,000 questions. I really hope you enjoyed this interview with Dr. Kong as much as I did. Now, Dr. Kong and I talked for another 45 minutes about peptides and again their incredible restorative and anti-aging benefits. But I didn't want this video to be forever long, so I stopped it right here. And next week I will upload part 2 of this video, where again Dr. Kong and I talk about peptides and their incredible benefits. Any questions or comments, of course, please leave them down below. I always love to hear from you. And of course, I will link all of Dr. Kong's information below this video. Thank you so much for being here. I will see you next week. Bye.